Today I'd like to talk about an important topic which I've been noticing for my 25 years of experience in chiropractic, and that is the link between musculoskeletal disorders and depression. Now, musculoskeletal disorders are really any pain syndromes of the spine, the knees, the shoulders, the neck, headaches, this kind of thing, exactly the kind of thing that chiropractors treat. So recently we've had a piece of research published which actually makes an association, a clear association between musculoskeletal disease and depression. Now, often when we are talking to our patients, even if it doesn't come up at the beginning of our consultation, we have them talking to us and they talk about the fact that they've had bouts of depression in the past, or indeed that they are still suffering from depression now. And this tends to come more when patients have long-term disability with musculoskeletal pain. May have been suffering for 6 weeks, they may have been suffering for 6 months or more, or even in many cases years of suffering with pain. Now, my message here really is that don't ignore your pain at the beginning, because it will maybe come and go and you don't tend to find the reason for your pain in many cases. And if you come to see us, or any chiropractor in fact, you'll find that the chiropractor will go to the bottom of your problem. That is, he won't be just covering up the symptoms with some kind of medication. What we will be doing is we'll find out why are you having pain, and we'll treat that pain with our methods that we use, which you can see on my Instagram profile anytime. So I'd like to just elaborate a little bit on the research that was done. This is a research from Denmark in the Danish National Research Centre. This was published recently in the Scandinavian Journal of Public Health, and the research itself was done between 2010 and 2015 in 21 municipalities of Denmark. And this is their finding that musculoskeletal pain, which, as I said, can be any kind of pain of the muscles, the nervous system and the joints in the whole body, including the spine and the bigger joints, is an indicator for depression in the general working population of Denmark. We need to remember that depression is the second leading cause of disability worldwide. So it's a very important precursor, let's say, for depression if we are experiencing long-term pain. My plea would be for people to realize that they don't have to always be suffering much of this long-term pain. Many times chiropractors can get their back pain, their headaches, their neck pain under control with a minimal amount of treatment, and perhaps even some maintenance treatment to keep them pain-free. So if you are experiencing any pain in your spine, your neck, your low back, please see a chiropractor and see if they can help you. It's something that's much more important than people sometimes realize. And you know, if your depression is known to be associated with that problem, even more reason to make sure you come and get treated. Even chronic patients come to us and get treated. I'll just give one example, without naming the person of course, of a patient of mine who had a very chronic headache situation going on. It was so bad that he lost his job, he lost his family, he lost his friends, because he admitted it made him extremely depressed and also very angry with life in general. And he came to me, and surprisingly even to me, he got better in 6 treatments, whereupon he was very upset because he felt like he could have done this years ago. So just one story among the many I could tell you about of people who've had very chronic pain for many years who we've been able to help. So I just hope that this message gets across to people. We can help you with your pain, whether you feel that you have depression from it or not. Many people, of course, don't have depression. Many people manage to keep themselves quite happy even though they have pain, and I'm very impressed with these people actually when they come to me. So, pain, depression tends to be associated, and this research has shown that that's the case, which I had been noticing all the time when I've been practicing.